metabolism rescue starts right here. And the reason this is so important is because there's so many people on the face of planet Earth today who have no clue that they're living in this thing that is so majestic and it balances all these things out. You know, when I say fearfully and wonderfully made, going through all these pathways and having to memorize that as a doctor too, you just get a crazy honor for this. You're like, this is weird. This is amazing. Like, you just have this reverence for this. Like, I remember in cadaver lab when you're dissecting cadavers, which sounds kind of gross, you're just going, this is majestic. This is freaky, crazy. And then you become so familiar with yourself that you're like, well, you know, it's like, I mean, it works pretty good. And if I eat okay, no. Listen, what you got to realize is you are you living in a vehicle that is majestic. And what you have to work with it so the majesty is still able to balance. Everybody with me? And that happens as a result of this system working the way that it should. And really, when you look at it this way, and most of you guys that are patients see it this way, brain has nerves, go to organs, and organs back to brain, and so it controls it. But that's oversimplifying it. What I want you to look at from now on is all these pathways, because that's what it really looks like. Isn't that complex? Isn't that amazing? Right? But watch this. How do you know if this thing's working right? Let me be very clear. This, again, if you're guests, get this. But this is not just for guests. Raise your hand if you're a patient in my office or our offices. This is for you too. You listen to me very clearly now. Are you ready for chairs? Okay, move those chairs. Boy, you guys are like organized today. You're waiting on me. This is the way it should look. Your spine should look like, actually, stand right there. You didn't know I was going to stop you, did you? This is Dr. Gisette. Dr. Gisette's over at the Southlake office. Can I get a, yeah, it's awesome. So you should have a curve in your neck like this. Got it? You should have a curve in your mid-back like this, and a curve in your low back like this. So your curve should be like this. And from the front to back, it should be what? What do they make all of our kids in grade school do? They bend over and look for what? Scoliosis. By law, yes or no? Yes, because in 1976, Irvin Cool won a Nobel Prize showing that the moment that your spine moves out of alignment, disease is started right then, and you die 15 years sooner than somebody that doesn't have that curve. Right? And yet that's why it's law. And yet how many of you guys, when you went to your doctor last, got your spine checked to see if there was a problem with it, with your nervous system? None. Your medical doctor doesn't know anything about it. I had a patient in my office last week. He goes, well, I want to get a second opinion with my doctor. I mean, and I shouldn't have said this, but it kind of like it was a knee-jerk reaction. I said, your doctor wouldn't know health that fell out of the sky and wiggled on his face. And I don't mean to be rude to medical doctors, and there's some medical doctors that do know what they're talking about. However, what are medical doctors trained to look for? Not this, but what? Do you have a tumor in your breast? Do you have high blood pressure? And then once you have those things, I'm going to treat that, not the cause of it. Right? That's good. Everybody round of applause. So let's do this. I want to bring this down to a level. Give you an example. So you should have these curves and not have curves. Like this should be straight up and down. This is specific. Okay. Now listen. I almost want to use a different word than chiropractic. I say chiropractic, and the whole world has just bastardized this word. I say chiropractic on an elevator, and everybody kind of gets away from me like this, like I farted. I say chiropractic, what you should hear is the greatest primary care doctor of your entire life. That's what you should hear, okay? Because this is a girl that came in. Is her back crooked on this side? Yeah, she can't have children. She's got polycystic ovarian syndrome and endometriosis, and she can't get pregnant. They're about to do a hysterectomy. Then you go get adjusted, what we do, specific correction chiropractic, and you start straightening out, her cycle comes back to normal, and you go to the last one, and then 2 months after this x-ray, she gets pregnant, right? Has a great baby boy. Awesome. Thank you, Jesus. First of all, do I know how to heal a uterus? I don't know how to balance any of that complex craziness. But you know what I do know how to do? I know how to work with the weird spaceship that you've been given to live in so that it works right. I don't have to understand it. I just have to make sure that it's working right. Remove the interference so it gets back to balancing like it should be again. Does it make sense? So when someone gets an amazing results, and you'll hear that here in a little bit, if you have amazing results, guess who gets the credit? Dr. David in chiropractic? Does Dr. David in chiropractic know how to heal anything? No. But guess what gets the credit? You get the credit for doing what you've done, and the designer gets the credit for the design doing what it should be doing. Right? And so watch. So yep. But watch, let me give you a result here. What's wrong with this girl's neck? Straight. What's wrong with her low back? Straight and actually reversed. And she's a nurse at a local hospital. She's got migraines almost every day, but a lot. She's got a lot of migraines and headaches, energy issues, focus issues. She feels terrible. She's sick all the time. She comes in, but before she comes in, she asked a friend of hers who came to the office about coming in and all the rest. And so she wanted to ask her what? Her doctor's opinion. She works with a bunch of doctors at the emergency room. So she asked the doctor on staff that night about going to see me. And well, guess what he said? Yeah, no way. Why? Because chiropractors are a bunch of quacks. And she said, well, no, he doesn't do chiropractic like that for pain. He corrects the spine, and people get amazing results. And he goes, listen, everybody knows you can't change a spine once you actually get through skeletal maturity, right? So based on what he said, and so that I can refute that, anytime any doctor ever tells you that, this is her x-ray of when she first came in, and there's her x-ray now. What do you see? So cycles better. Guess what happened to her headaches? Guess what happened to her energy issues? Guess what happened to her focus? Guess what happened to her ability to sleep? Guess what happened to her life? So when she went back, here's the thing. When I took these x-rays, she was excited. And I was excited for her. But I remember what she said about that doctor in the emergency room, and she was still working with him. And he was trying to talk her out of coming to my office, by the way. And actually, after her first 2 weeks, she was feeling better. She was like, no, you go do your thing. I'm going to go do my thing. And so when she said, I said, you should go tell that doctor. And she goes, oh, no, I'll mention it to him. And I go, no. I want you to take the x-ray. Because there's proof in the pudding. Everybody hear that? Right? I love that you feel better, but don't just show me I feel better. Show me that something's fixed. Got it? And that's the difference in what we do. And some of you guys are guests in the office or here in the house today, and you have never, ever even got your spine checked. So before you start fasting and doing a controlled eating window and like keto fasting and doing all this, before you start really getting crazy on some stuff, before you even know if the little alien spaceship you're living in is even working right, you better figure out if it's working right. Does it make sense with you?